the FIV test. When we have a cat that's got unknown history, that's the first thing that you want to kind of rule out. I think we think she's about 6 months old, I believe. You found her when?
Yeah, May 12th. She was really little.
I'm just gonna make her April 1st. And she hasn't been spayed, correct?
No, ma'am.
She's a kind of a long, medium hair, I would say. Then, what was your color? Hi there. Are you a little, you got a little tricolor too. Brown tabby. So the good news is it's negative FELV, FIV. That's the good news. Getting into our CBC, and I drew her sample. Her platelets are very low.
What's that?
It is basically what makes your blood clot. And it can be falsely lowered when we're sick and not feeling well. The other thing is if I kind of nitpick her gum color, it's a lighter pink, and she is mildly anemic on her blood work. And then her total white blood cell count is on the higher end of the normal range. Healthy cats are going to run about 6,000 to 8,000, and she's about 16,000 for reference point. A red blood cell count that I feel is like normal in a cat is about 37 to 42%, and she's 29%. And then platelets should be a minimum of 125,000, and she's sitting at 70,000. Now, you can get cats that they just clot all their platelets together, and so you get a falsely lowered component, but we typically need to run a blood smear on them to get a better idea. Now, getting into the chemistry side, we have a negative feline pancreatitis test, so that's not the reason for her inappetence. I'm glad we ran it because when we look at her amylase is non-specific for how my pancreas functions. And the higher it gets to the abnormal range, the more commonly we see pancreatitis. In her case, she's probably got elevated amylase because she's not clearing the GI tract because she's not really eating consistently. But I think the biggest thing that I see that makes me kind of sad for you is her total protein's 9.1 and her globulins are 6.4. There is a condition in cats called feline infectious peritonitis, so FIP. And there's two types of FIP in a cat. There's what we call a dry form, which is the hardest way to diagnose a cat. And then there's a wet form, and a wet form means that they build fluid sometimes in their chest, sometimes in their abdomen, and she doesn't have either of those components. The biggest thing is like exam findings on her. She's very warm to the touch. She's got a temperature of 105.1. That's part of the reason she doesn't want to eat. Okay, now FIP is so, I'm gonna say like kind of just fucking hard to diagnose, especially in a dry form. A wet form, you can take that fluid and you can send out very specific testing, and it tells you, hey, yeah, this is confirmed FIP. The blood work results that I have on her with her globulins, which are a type of protein, being above 5 is pretty consistent with FIP. Getting a total protein above 8 is more consistent with FIP. So your albumin, which is a protein, and your globulins are paired together to give you a total protein, but the globulins are 97% of the time the only thing that's affected by FIP. So the rest of the blood work looks clear. Now, if you had seen me, I'm gonna say 3 years ago, maybe 4 years ago, probably closer to 4, I would tell you FIP in this state, unfortunately, is almost always a death sentence. And it still is very, very concerning, okay? But there is this, what I'm gonna call warrior group out there. It is kind of a black market option for FIP that basically ties my hands as a vet because it's so off-label and black market that I can't do it. But I can have a conversation about this and have you find your own cat drug dealers for this medication. I will tell you that the preferred treatment is something called I don't even remember. I have to look it up each time. FIP treatment. This GS441 is basically this drug that we found that's injected. I believe it's an every single day injection for X amount of days, and it's designed to put these cats in full-blown remission. I believe it's fucking expensive. I'm just gonna tell you. I don't know the cost because I'm not allowed to know the cost. My hesitation is we had one client that successfully went through it, but this cat, the injections are acidic, so they burn. And the cat that we were trying to use the injections on, like, scratched everyone, and it just wasn't gonna happen. So there is an oral version, but it's not as well, it's not as popular because I don't believe it works as well. But I believe that cat went into full-blown remission, okay, ultimately. So in this scenario, there is a treatment option. Because I don't know of anyone who does it, because it's so like off-label and like we're not allowed to treat it. And I hope this comes, if I'm just being honest with you, I know it's being studied at UC Davis. I think we'll have access to it at some point, but I don't know. Because I believe the drug is compounded in like China and then it's shipped overseas. Like when I say like it's kind of sketchy stuff, but we know that cats are living with it, okay, and going into remission, and we check lab work and all of their values and parameters are normal. Because I don't know the cost of it, I bet you I could reach out to my old client that went through it and see at least they have the contact information of like someone local in the area that they got it from. But like I have to be almost like hands-off approach, but that cat did not tolerate the injections, and it's because they're so acidic. I think they're like a 1.5 on the acid scale. So anything below 5 is pretty damn acidic. So if we're all the way down that low, it stings. Now she's got a much better temperament, but I don't know how much better it is because she just doesn't feel well, and how spicy she would be if she was feeling well. But I can at least try to get you in touch with the right person. But there is this whole Facebook page called FIP Warriors that you can get in and do research. Now, as far as like what can I do to make your cat feel better in the meantime, is I can try to give her a couple different things that improve it while you're doing the research to try to get this drug. Is that something you're interested in? Because it used to, I would see this and I'd be like, hey, like humane euthanasia is like the most realistic thing to do, but the flip side to that is that's not the only option, thankfully now.
Well, I guess I'm curious to see.
I can have Vanessa. I know it's. Hey, Vanessa. Vanessa! Do you remember that cat you tried to give the FIP injection to? And she like sliced you and diced you?
That was the blacks.
The blacks.
Yeah.
Can you call them? Yeah. Can you call them and give me an idea of where they got their drug from?
Okay.
And they give me a rough idea of like how much they spent?
Okay.
Cause I think it was.
The one that they did at home and went to the other, yeah. Yeah, that was Peaches.
Cause she's in remission now, right? Yeah, so that was 2 years ago. But the cat, ultimately, how we diagnosed it is the cat basically went blind, and so it had an acute juvenile case of like blindness, and it all like a very unusual presentation. So we had kicked her off to the ophthalmologist, and the ophthalmologist was able to get the blood work, which I wasn't able to get because she tried to kill me here. So at least I have, I'm gonna say, confidence level in this of my diagnosis 85 to 90. Like there's a piece where I'm like 95% confident. I just don't know without all the confirmatory testing, but the confirmatory testing in a dry form is really, really, really hard. And so we just go based off like globulin levels. But what I can do for her is I can give her some fluids under the skin to help kind of cool her temp, and it helps hydrate her. I can give her something to stimulate her appetite. I can give her something if she's just nauseous and not wanting to eat, a B12 Cerenia injection. I can give her some of these things while we're researching and trying to get her to feel better, because there is a point where when cats don't eat, their body starts to attack its liver, and then it becomes this very vicious cycle. Now, going back to her liver values, everything looks good right now, but I will tell you that her serum is in this like, I'm in an anorexic phase and I'm starting down that like self-attack of my liver. Okay, so that's the direction she's headed, but there's a piece where she just doesn't feel well because her body temp is so high. I think if she didn't have FIP, like I would consider doing like an anti-inflammatory injection to try to bring down her body temp, like basically a cat ibuprofen. But I don't know, I can't use steroids with the FIP because I'll make it worse. An NSAID would be safer and it would help drop her temp. So there are things that we can do, but it becomes like, this is tricky at best because it like ties my hands where I'm like, hey, go look at this really sketchy website, find this black market of drug, and go forth with a treatment. But they do have an oral formulation if she doesn't tolerate the injections. And it's all over like this stuff. Whew. $700 for this place. Capsules, pills. Have you ever pilled a cat?
No.
So this is FIP Rescue. 12,000 cats to cure in the US and Canada. They're the only one that offers a lifetime cure and no relapse and free return. I don't know if I believe them, but. And it looks like they just have a map here in Texas of like how they track it per state and everything.
Mhm.
So that's just one of the many groups that you can find online. I think FIP Warriors Facebook page is probably your best. I was like, the injection 4 mg per kg sub Q 24 hours for 12 weeks. Ugh. I would hate you if you injected me every single day for 12 weeks.
Yeah.
I thought it was like 6 weeks. 12 weeks, 12 weeks. But UC Davis has a paper out about it. I can print this off as a good article for you to read. Treatment is hard on both owners and cats, as injections are painful. We did talk about that. Response to treatment is usually within 24 to 72 hours, and most cats are back to normal within 2 to 4 weeks. We feel that the cure rate is over 80%. Treatment failures are due to misdiagnosis of FIP, inadequate dosage, complicating disease conditions, drug resistance. Young cats are easier to treat. However, they have a higher cure rate than cats 7 years old or of age or older. With wet or dry FIP not complicated by neurological or ocular disease. So again, eyes look good, neurologically she still looks good. So they recommend CBC chemistry check. And then they recheck every 4 weeks thereafter. Weight, yeah, so but this is the closest veterinary source that I've found that's going to tell you, hey, this is what's going on. Has she a significant weight gain is a good thing? Okay, so they're saying weight gain is a response to treatment. Dosage has to be adjusted as the weight goes up, so you have to keep an eye on her weight. Injection site soreness is the most common complication. I recommend that the dose would be adjusted weekly with weight checks. Weight gain can be tremendous in many of these cats. Failure to gain a good amount of weight during treatment is considered a bad sign, so at least you have some of that information. She does not increase dosages based off that. One of the most difficult decisions is to determine when to stop treatment, although some often younger ones with wet FIP can be cured as little as 8 weeks and possibly sooner. The usual treatment time is 12 weeks. Again, this just talks about there's no definitive test to basically tell us like if your pet's relapsed. It's 84 days, I guess that's 12 weeks.